Today, I will show you how we assist upper extremity patient. We use shoulder range of motion to be a functional test, and we can call the patient to do the active range of motion with the shoulder abduction. Okay, and now we can see and link to the patient's symptom about the right shoulder uncomfortable or shoulder limitation. In the neurec test protocol, first we use the performance plus to change the myofascial chain tension to check which side is the primary problem issue. So the first performance plus is the abdominal squeeze. We use our hand to squeeze patient's abdominals to increase the core muscle tension to see the functional movement change. So we squeeze the abdominal and going to do the same movement. Okay, and back. Do you feel any uncomfortable?
No.
It's better than before?
Yeah, it's all good.
Okay. And then the second one, we use our hand to push patients tight for the abduction performance plus. So tell patient to squeeze your hand. Please squeeze it and do the functional movement again. Okay, back. Do you feel any uncomfortable?
No.
It feel better?
Yeah, a little better.
Okay. Then the second one is the hip abduction. So we use our hand on the lateral side and tell patient to push your hand, push, and do the functional movement again. Okay. So do you feel any uncomfortable?
No.
And feel better?
No.
Okay. So in the core and low extremity performance plus, we can see the abdominal squeeze and hip abduction will be will improve the shoulder functional movement. Then we can progress to the upper extremity performance plus. The first one is the scapula retraction. So tell patient to retract his scapula and do the functional movement again. Keep the scapula retract. Okay, we can see the scapula, the range of motion will be limited in this performance plus. And ask the patient, do you feel any comfortable?
No.
And feel better or not?
Not so easy.
Okay, so it's become more difficult. And the last one, we can assist patient's scapular movement to see the functional movement change. So the scapular assist to hold your hand on patient's scapula and assist the scapular upper rotation during patient's movement. So we can do the scapula. Okay, so we can see more range of motion improvement. Okay, so after the performance plus test, we can find the abdominal squeeze and the hip abduction and the scapular assist will be improved patient's functional movement. So in the neurec test, we can test the about the core muscle or lower extremity fascial tension, and also the scapular movement to decision that which part we will intervention first. Okay. After performance plus and the neurec test, we have to see the neurec neural test result. And based on the performance class, we found the lower extremity fascial tension change will change the functional movement. So in the neural test protocol, both upper extremity and lower additional test we should test after the performance plus results. So in the performance plus, we can see the abdominal squeeze is can change the functional movement. So the supine pelvic lift will be the important neural test, and both upper extremity neural test should be tested in the upper extremity patient. And the additional test about the performance plus results, we see the patient with the hip abduction improve the functional movement. So we also test the lower extremity neural test to make sure there's some problem progress to the upper extremity. So in the neural test protocol, we can see there's all zero dysfunction level in this patient, but there's some different during the each movement. From the supine pelvic lift, the left side is worse than the right side, and we can see the patients say the left side is more difficult to do the supine pelvic lift. And in the scapular protraction, both sides we see the trunk arching and the arm shake. So we can link to the abdominal squeeze and the supine pelvic. We can think that the patient's core muscle stability would has to training up in the direct treatment. And with the one important one is the shoulder abduction and external rotation showed a significant left upper back side bending. So we can know that the shoulder abduction and external rotation will be the treatment, will be included to the neural treatment first, neural treatment. And in the additional test, it's the same result with the performance class, because we can see the sideline hip abduction showed more weakening during the neural test. So in this patient, we can see that the first treatment procedure will from the proximal to the distal. So we could maybe start with the left supine pelvic lift. Then in this patient, we can see the lots of weakening is more in the left side, but the range of motion is in the right side. So we can think that the range of the functional test, the limitation from the left side compensate. So we can training the lower extremity first to give him a stable base and good trunk stability. Then back to the scapular protraction. It's because it's more distal part in the upper extremity. Then the last treatment may be the shoulder abduction with the external rotation, because there's more trunk issue in this movement. So in this clinical listing, we can see that this patient maybe should do from the core to the lower extremity, and thinking about maybe the spiral line and the frontal line to keep the myofascial chain stability, to make sure the functional movement will be improved. Thank you. before we starting the neural test, we have to make sure the safe for the equipment. So we use the middle one channel because we can make sure the suspension point is stable and safe during our test. So make sure your brake and your channel is stable. And then you can call the patient under the suspension point to measure the sling height. The sling height should be used it should be on the fingertip level. So you can use use this index tip to measure the sling height, and then call him step forward 1 feet length, 1 feet length, step forward, okay. And put the strap on his elbow. Okay. And now in this way you can help him for safety. So please step forward and make your weight on the strap, okay? And back the front feet backward and keep your trunk in the line. So in the first time, we should teach him to do this movement. So please retraction your trunk and protraction, okay? And keep in the middle, okay? And backward, okay? So when we teach, after we teach the movement, the second time we have to correct his movement. So please step forward, and we're going on the rope and backward again. And you have to make sure your trunk in the line and the heel in the ankle and heel in the neutral position, and start to find your middle position of the thorax, okay? Keep your forearm paralyzed and stable, okay? And backward again. Okay, do you understand the movement?
Yes.
Okay, do you feel any pain during the movement?
Okay.
Okay, and the third time, when on the rope, step forward, okay? And you have to do the movement by yourself, okay? So please find your middle position and keep your trunk straight and ankle in a neutral position, okay? Again, we have to observe the movement about 3 seconds. And we can see the overactive in the right upper trapezius and the trunk arch, and forearm not paralyzed. Okay, backward. Okay. So after our neural testing, we can find his right side have uneven upper trapezius movement and a lot of shoulder rotation and trunk arching. And the result showed the patient doesn't pass the zero label neural test. So we give the point about zero dysfunction and 0 D. If he can pass the zero label, we can we can change the strap to the power grip and change the sling height to the patella base, and try to let him to do the level 1 movement and go to the level 1 neural test if he can pass to the 1 point. So we can decide the treatment need or not if based on each patient's ability. after the neurec test, we can find our patient has some issue from low back, from his scapula, and we found hyperactive of the trapezius and lumbar arch. So in neurec treatment, we should start from the low back and axial trunk to increase the whole trunk's axial stability. Then that maybe can improve the upper extremity performance. But we use the performance plus with the scapular assist, and we can find that the scapular movement become more smooth. So we demonstrate this neurec treatment with the with scapular protraction, and to facilitate patients' thoracic superior to increase scapular stability and to improve the performance of the shoulder movement and upper extremity. And in the neurec treatment, there is a good equipment called stimuli can help us to facilitate the patient's neuromuscular control. Here's the stimuli. The left side is the training type, and the right side is the training frequency. And this slide is about the energy level. There's the 1, 2, 3, and 4 level. If you want to more challenge in your treatment movement, you can press it to the energy level random mode, or press more longer and go to the all random mode, both rendering the energy level and the frequency level. And in the treatment, if we want to increase the proprioception input to the muscle spindle, we should make the training frequency about 40 Hz. And if you want to increase the neuromuscular control, maybe you can up to the 80 Hz to help you to direct treatment performance. Then, if you want to increase muscle strength or muscle performance, there's you can keep the frequency about 30 Hz to 50 Hz. So in this lecture, we have to increase we want to increase the thoracic center performance. So we will set the energy level of about 2 and keep the frequency level to 50 Hz. And when we start this treatment, we can tell the patient leaning on the table and prone on the elbow. Okay. Use table up to make the patient can get a safe start position, and you have to support him on upper body. And when we treat with the hip depression, we can decrease the complications and help him to focus on the scapular region. So, on the elbow. Put your strap on the elbow and tighten and down the table to the trunk in the strike position. Okay. Make sure patient's elbows direct under the shoulder and 4 hours apart. hollow. Okay. We can teach the movement. Please retraction your scapula and protraction your scapula and find the middle position and keep here. We start from the isolation, the protocol, about 20 seconds. Keep your forearm, okay, good. Okay. Do you feel any pain? Can let him take a rest. Okay, good. Are you okay? Okay. If the patient can pass the isolation treatment protocol, we can go to the myofascial chain training. So we can call him to do the retraction starting position and back to the middle side to do the protraction movement. So we repeat about 3 to 5 times and 1 retraction and back to the middle. 2, keep your elbow close. Okay. And 2, backward. Good. 3. Good. Okay. Take a rest. In the treatment, we should take rest about 30 to 60 seconds. Make sure the stress issue don't interrupt his neuromuscular control. Are you okay? And we also can change the energy level to increase the treatment grade. So in the upper limb, we can change the energy level from 2 to 3. If you train the lower extremity, you can maybe start from 3, energy level 3 to 4. Okay. So we increase the energy level and do the same myofascial chain exercise. Okay. With retraction, your stomach up, okay, and backward, good, and down again, and back again, good. And one more. Keep your muscle, okay, okay, good. No lama, okay, okay, stop. Take a rest. Are you okay? Do you feel any pain? Okay, okay. So there's a lot of upgrade solution for this treatment. You can also decrease the support and decrease the unloading level. But our patient feels lots of uncontrolled his lumbar because maybe this is too difficult for him. So we can stop and down and take off the sling first. Okay, and in up, good. Are you okay? Okay. Then we can up down to the ground. And after we treatment, remember we should always do the functional test. So take your shoes off. And we do the same functional test. Keep your feet, okay, and do the arm rise. So you can see this wing scapula is more improved. There's more scapula upward rotation, and it can more smooth touch on the thoracic region. And the movement is more equal in the both shoulder. So, do you have any pain in this functional movement? Okay, that is our neural treatment program. Thank you.